My name's Lisa. I'm a physical therapist at MedStar Georgetown University Hospital, and today we're going to talk about treating patients with Parkinson's disease. Parkinson's disease usually affects men more than women, and it usually affects men about middle age, between 40 and 60 years. Often, a diagnosis of Parkinson's comes a year or two after the symptoms appear. There are 4 classic signs. One of them is rigidity, more stiffness. So what we like to do in physical therapy is work on stretching and flexibility. Another symptom of Parkinson's is tremor, and unfortunately we as physical therapists are not able to control tremor. However, we are able to give strategies to patients to minimize tremor. Another symptom of Parkinson's disease is postural instability, which is balance, and usually that doesn't come on right away. Usually that comes on later in the disease, but working on balance in physical therapy on different surfaces. We like to put people on pillows and foam and have people stand on one foot, eyes open, eyes closed, just really varying the environment to challenge the patient's balance in all situations. The 4th sign of Parkinson's is bradykinesia, the decrease in amplitude of movement. So what we teach patients in general is to increase the effort that you move in. If you increase the effort that you move in, the amplitude of the movement will be larger. 1, 2, 1, 2. One thing that I think is misunderstood about Parkinson's is Parkinson's disease is not only a motor disorder, it's also a sensory disorder. So there's a mismatch between what people think they're doing and what they're actually doing. So your patient with Parkinson can say, well, I'm moving my arm really high, but in actuality, their arm is not moving much at all. So there's a positional sense that is difficult for people with Parkinson's to have that awareness of. A lot of people that have Parkinson's are unable to multitask, but as we know in our day-to-day life, that is what we do all day, all the time. So we start with a simple task, have the patient master that task, and then we make the task more complicated. One thing that we offer here at MedStar Georgetown University Hospital is a Parkinson's exercise class, which also functions actually as an informal support group where we work on the common impairments associated with Parkinson's. Yes, there are a lot of people with Parkinson's, but it's hard to get them all together and for everybody to know each other and have these discussion of, well, this works for me, does this work for you? And we like to have a little informal discussion in the group so people can talk to each other. Learn how a physical therapist can help you at moveforwardpt.com.